Yeah, thanks for being there. Nigeria is working to strengthen rehabilitation services through the implementation of the WHO Rehabilitation 2030 initiative to integrate care at all levels. In this report, Elizabeth Omori looks at the global initiative launched in 2017, Nigeria's preparedness and plans to meet the implementation to address rehabilitation needs before 2030.
Life, they say, can change in a heartbeat. One moment, everything feels normal. The next, a sudden stroke, a road crash, or a major surgery changes the course of a person's life forever. And in those difficult moments, the question is often no longer just about survival. It becomes about what happens after the long emotional journey of learning to walk again, speak again, walk again, or simply live independently once more. As Nigeria's population grows and ages, stories like these are becoming increasingly common, placing rehabilitation at the center of conversations. The good news, however, is that Nigeria is now joining a global initiative to make rehabilitation services an integral part of healthcare delivery. Under the World Health Organization's Rehabilitation 2030 initiative, Nigeria is making rehabilitation a next major health priority.
The ministry has started initiating action. The minister approved integration of rehabilitation into primary health care. In fact, equipping of some primary healthcare centers that will serve as model for the primary healthcare rehabilitation primary healthcare has already started.
We have a program called Basic Healthcare Provision Fund, not really a program, but it's a fund put together by the federal government, which is 1% of the constituted revenue fund. Then other support donors and all that bring in funds into there. So all those funds pulled together have 4 gateways. Now, from that program, people in the hinterlands can access care for free.
It's commendable that such strategies are being put in place to rehabilitate persons with disabilities or other people living with one form of vulnerability and the other.
It's a good thing for Nigeria to have a rehabilitation center for people of accident victims and crisis victims.
Stakeholders insist rehabilitation is no longer optional in modern healthcare. Elizabeth Omori, NTA News.
Now, in the studio is the 4th Registrar and Chief Executive Officer of the Medical Rehabilitation Therapist Registration Board of Nigeria, MRTB, Professor Rufai Yusuf Ahmed. He is a professor of neurological physiotherapy at Bayero University, Kano, a fellow of the Nigerian Society of Physiotherapy, and served as national president of the Nigerian Society of Physiotherapy, as well as the member governing board of a medical rehabilitation therapist. You're welcome to Weekend File.
Thank you very much. Nice to be here.
Okay, Prof, when many Nigerians hear the word rehabilitation, the first thing that comes to mind is often drug recovery centers or mental health institutions. But in the healthcare context, rehabilitation is much broader. Can you help us properly define rehabilitation and explain why it is becoming such a critical part of modern healthcare delivery and what illnesses fall into these categories?
Thank you very much. So actually, WHO says that health is beyond just the absence of disease or injury. There's also the context of well-being and quality of life. So what this means is that what we are used to is that someone will have a disease. Maybe you have an infection, maybe someone will have, just like you have a stroke, blood accumulates in your brain, and possibly you have a fracture or you have a dislocation. So these are injuries and diseases, and people go to the hospital. They either see a physician, they get a drug, or they go to a surgeon and they get surgery. So these are all aspects that are called impairment. For example, if someone has a movement-related problem, you sit for a prolonged period, or you do repetitive activities with your body, and you go to a physiotherapist to get treatment for low back pain, for knee pain or neck pain, all these are treatments that are termed impairment under what is called the ICF, International Classification of Functioning, Disability and Health. But beyond the impairment, the disease or the injury can affect your ability to do activities of daily living. So you may not be able to walk, you may not be able to eat, you may not be able to hear, of course, because there's also the issue of disease and injury can affect your hearing, it can affect your speech, it can affect your mental state, conscious level, your ability to remember things, your ability to comprehend and process information, and your emotions. So all this at the level of impairment. The impairment can affect your ability to do things, to speak, to hear, to move, to walk, and to eat, and to do many other things. But beyond disability, there is also handicap, meaning the disability can affect your ability to be able to interact with the society. So you can walk, but you may not be able to cross the road, because crossing the road will come with a lot of other things that are beyond just physically walking, meaning you are going to interact with traffic light, another car crossing by, and therefore you are integrating a lot of systems of the body, the sensory systems, the mental system, and the physical. And so all this can affect your ability to interact. You may not be able to go to the market, walk through a busy street, be able to buy things because of all those impairments affecting the disability and also giving handicap. The United Nations has these developmental goals, sustainable developmental goals. Number 3 says health and well-being, meaning it goes beyond just health, it's also well-being. But with rehabilitation, it goes beyond just health and well-being. SDG 4 is about education. If you are having problems with disability and there's no rehabilitation, then you are going to have a problem with education, accessibility, and being able to understand what the teacher is saying, or hear him, or understand him. Also goes beyond that, work and job, because you have problem getting integrated into doing your job. And also inequality, which is SDG 10. But in all this, rehabilitation meaning is now about after impairment, after disease or injury, how can someone give you the intervention that is going to help you to be able to move from disability, resolving disability, and also being able to interact with your environment.
All right. Many thanks, Prof. One of the key pillars of this initiative is integrating rehabilitation into primary health care. For the ordinary Nigerian watching, what exactly does this mean in practical terms? And what additional services or areas of care are expected to be covered at the community and primary health care levels?
Yes, so there are 3 levels: the primary healthcare, the secondary, and the tertiary. But also, there is the community level. In some other countries, there are even about 6 levels of the health system, care system. At the moment in Nigeria, we have rehabilitation at the secondary and the tertiary levels. There is no rehabilitation at the primary healthcare level. And what do you need to have rehabilitation at the primary healthcare level? There are 6 components or 6 building blocks of the health system. Traditionally, we focus a lot on the workforce and the service delivery. So the workforce is about producing the health professionals that are going to deliver the rehabilitation services. And we have many of them, physiotherapists who deal with movement impairment, the movement specialists, rehabilitate people to be able to move them from disability and be able to interact with the environment. We have occupational therapists that deal mostly at that level of participation, meaning they help people that have handicap to be able to go into their jobs and be able to do most of the activities of daily living that they need to do in the communities. We have speech therapists that deal with the speech, and then the audiologists that deal with hearing, and then prosthetics and orthotics that help people with assistive devices or artificial limbs. But there are also clinical psychologists that help people that have psychological problems to be able to integrate them into the other aspects of rehabilitation. But also physiatrists or physical medicine. And there's also rehabilitation nursing, social workers. So we need all this. In Nigeria, we have medical doctors, we have nurses, we have physiotherapists. Physiotherapists are just less than 8,000 registered in the whole country. And we don't have middle-level manpower, community rehabilitation workers that will go into the community. And therefore, what the Ministry of Health has done, the coordinating Minister of Health approved that rehabilitation should be integrated in the primary health care. And what we did was from the WHO documents that were developed for the Rehabilitation Initiative of 2030, there is PIR, Packages of Intervention for Rehabilitation. What it does is to list all the interventions, the equipment required, and who should deliver the services, and they categorize them at the different levels of the health system. And therefore, we use that document, extract that of primary health care, and we submit it to the ministry. And the minister approved. And it has been institutionalized at the primary health care agency at the moment. So apart from the workforce, the service delivery, very important. How do you deliver service? What are the referral mechanisms? When someone gets to the primary health care center and he's assessed, identified that they need rehabilitation, you refer to the general hospital. From general hospital, you refer to a specialist hospital. So these are all things that are happening at the moment, but also something very important, community rehabilitation.
All right.
MBTE, the board, our board, and community practitioners board working on coming up with a curriculum for community rehabilitation workers that can go into the community and primary healthcare levels to be able to deliver rehabilitation services.
All right, Professor, let's take a breather now, and the news will continue after these messages. Don't go anywhere. Thanks for being there. I still have with me in the studio Professor Yusuf Ahmed, the Registrar CEO of the Medical Rehabilitation Therapist Registration Board of Nigeria. Now, Prof, very quickly, let's go to funding. Beyond government funding, is there a role for private sector investment in driving this rehabilitation agenda forward?
Yes, definitely. The part of the Rehabilitation 2030 initiative, one of the very fundamental aspect of it is the issue of rehabilitation financing. In fact, the WHO has come up with a document on rehabilitation financing, looking at how do you even prepare? How do you do needs assessment of equipment, the workforce, and many other things that are required? How do you do costing for it? And then how do you do a brief for all those that will be involved in financing? And so if the government considers part of it in the budget, then you can be able to present that brief to the, all other NGOs and other funding bodies that are interested in funding a rehabilitation. One of the problems that Nigeria has had with the issue of other stakeholders funding rehabilitation in Nigeria was the fact that there was no policy and strategic plan. And most organizations would want to look at your policy or your a strategic plan to be able to see where they can key in, and then they will put it as part of their own budget for the year that they want to give you the funding. So that document is there with the strategic plan and policy coming up very soon. This is going to facilitate NGOs and many other stakeholders to be able to fund rehabilitation in addition to what government has been doing and what government will continue to do with financing. Of course, we know that two other major issues, budget lines. If you don't have a budget line for rehabilitation, it might be subsumed into other budget lines. And that will affect rehabilitation because it might not be compulsory for someone to put it into rehabilitation. But if there is budget line for financing, for financial rehabilitation, it will be compulsory. You must spend into rehabilitation. Another thing is the NHIE. In the past, there was only physiotherapy was covered, and also based on condition in the pricing for services in the NHIE. But there was a submission, we made a submission to the coordinating minister, and it was approved, and the NHIE is now reviewing its pricing to be according to the interventions given rather than the conditions, but also not just physiotherapy, let it cover occupational therapy, speech therapy, audiology, prosthetics and orthotics, and all other rehabilitation services that are offered in our hospitals. All
right, now with these finances and budgets being taken care of, how accessible and will it be for the people that are in need of these services? How accessible?
Well, I think access, we are talking now about universal health coverage. And with universal health coverage, we are having three different aspects, very important aspects. Who is covered? It doesn't matter whether you are rich or you are poor. It doesn't matter whether you are living in the rural area or in the urban areas. And also the second thing is about the issue, what is covered? So the services. You have medicine, you have nursing, you have physiotherapy, you have occupational therapy, just like I've mentioned all of them. And at the moment, as I've said, it's not there in the primary healthcare level. But with this implementation at the primary healthcare level and having community rehabilitation workers being supervised by the professionals, this is going to increase accessibility. Another thing that has happened recently that's very significant is the Minister of Education approved that 20 universities should start all those professions that have not been on ground. Occupational therapy, speech therapy, audiology, prosthetics and orthotics, we have less than 500. We have registered less than 500 in the whole country. But with this initiative, 20 universities starting in all the regions of the country, we are going to have an increase in the number, and that will be significant. The Minister of State for Health has also approved a PPP project where the professionals that have not been engaged in government work or don't have private practices can come up with proposals, work with the hospitals to be able to partner and establish a PPP, so that so many people that are out there not having a job cannot be able to have a job, and that will increase the accessibility.
Okay,
so with all these plans, I believe we are going to have more access to rehabilitation.
Okay, many thanks, Professor Rufai. Very quickly now, implementation is often where good policies face their biggest test. What is the assurance that this initiative would not just be swept under the carpet?
Well, for us as rehabilitation practitioners, I must say that this is our best time. We have the Renewed Hope agenda that focuses on health reforms, and this is health reform. We have ministers that are pushing for these agendas to be implemented, because all the ministers that I've mentioned have given evidence that these are the things that they have done to improve the rehabilitation services in Nigeria. But most importantly, the Coordinating Minister of Health has approved that the Rehabilitation 2030 initiative of the WHO should be implemented. There are 4 stages. We have already completed the first stage, which is the situation assessment. WHO was with us here last month, 28th and 29th, and we did the validation of the situation report. Currently, the strategic plan and policy are being developed, and the ministry, we are hoping, is going to present the policy at the next National Council on Health, because the moment it's approved, then it's going to be owned by the federal and the states, and then implementation will be streamlined.
All right, Prof, thank you very much. I know you still have loads of information to give us, but let's quickly take this break, then we'll come right back. Glad to know you're still there, and my guest has been the 4th Registrar and Chief Executive Officer of the Medical Rehabilitation Therapist Registration Board of Nigeria, Professor Rufai Yusuf Ahmed. Thanks for your insights on Weekend File.
Thank you very much. Pleasure to be here.